Covering the posterior compartment forearm muscle. So what we're going to essentially do on this tutorial is look at this image that you see right now, which is the posterior side of the arm, as we were looking at the anatomical position of the arm, and then looking at the back of your arm and seeing these muscles that you see here. And we're going to be describing them, not only being able to identify these muscles, but also talking about their origins, insertions, innervation functions, and a little bit of related clinical anatomy. Now, the posterior compartment of the forearm is divided from the anterior compartment of the forearm muscles, which, by the way, there is a tutorial here at KenHub that you can watch and learn about the muscles that you find on the anterior compartment of the forearm. And these two compartments are divided by deep fascia, the lateral deep intermuscular septum, and the interosseous membrane between the radius and the ulna. First thing I would like to say about the posterior compartment forearm muscles is that they can be divided into two categories or two groups. One of them is known as the superficial muscles, or a superficial layer of muscles. You also find a deep layer or the deep muscles of the posterior compartment. Now, we're going to start off with the very first one here on the list, which I'm going to isolate here. Notice the image. I just erased the deep layer so I can just isolate the superficial muscles of the posterior compartment of the forearm. And as I mentioned, these will be then 6 muscles, which include the brachioradialis, the extensor carpi radialis longus, the extensor carpi radialis brevis. And keep in mind that these 3 muscles sometimes are divided into a separate group, which is known as the radial group, or the radial muscles of the forearm. And if you notice here on KenHub, we have a separate tutorial and a separate quiz which will deal with these muscles separately. But you can also talk about them as part of this superficial layer as well. The other 3 muscles will then be the extensor digitorum, the extensor digiti minimi, and the extensor carpi ulnaris. Now, the easiest thing to learn about the superficial muscles of the posterior compartment of the forearm is that they're all going to be innervated by this nerve that you see here highlighted in green on this image of the forearm. And keep in mind that right now we're looking at the arm from an interior view of the anatomical position, but the nerve is going to course to then the posterior side of the forearm, where it's going to be then innervating this group of muscles. And this nerve is then the radial nerve. And now that we know that, we're going to now talk about the different origins, insertions, functions, and a little bit of clinical anatomy later on about the different muscles that I listed before. And we're going to start off with this one that you see here highlighted in green. And also we're looking at an anterior view of the forearm here. But of course, if you were to look at the posterior view, you also see this muscle, which is the brachioradialis. And this powerful muscle is mainly responsible for the lateral contour of the elbow and forearm. In terms of origin points, it's going to be originating from the lateral supracondylar ridge between the brachialis and the lateral head of the triceps muscle. And you notice here that this would be the lateral supracondylar ridge of this bone here that you see partially, which is the humerus. Another point of origin for the brachioradialis is the lateral intermuscular septum of the humerus. Now the muscle is going to go all the way distally to then insert at the styloid process of the radius, as you can see here on this image. And notice that the radius should be found in this direction, while the ulna is going to be found right next to it, a little bit more medially. Now you can see that the radius is covered by this layer of muscles, which are the muscles of the anterior compartment of the forearm. But here you see a little bit of the styloid process of the radius, where the brachioradialis is going to be inserting. The next thing that we're going to be covering about the brachioradialis, and you can see here now the muscle in action, and this is going to be then the functions or actions associated to the brachioradialis. And if the brachioradialis muscle contracts, it will then perform flexion of the elbow joint, as well as pronation and supination of the wrist, depending on the position of the arm. And you can see supination and pronation being represented here by these arrows. The next muscle that we saw on that list is now seen here highlighted in green, and now we're looking at a posterior view of the forearm. The highlighted muscle is then the extensor carpi radialis longus, and the majority of this muscle will be lying underneath the brachioradialis, the muscle that we talked about before. Now, in terms of origin points, it has an origin slightly below the lateral supracondylar ridge of the humerus, which you can also see here. The muscle will go then distally to insert at the posterior side of the base of the second metacarpal bone. Notice here, this is the second metacarpal bone, and the base would be a bit proximal here, and this is the insertion point for the extensor carpi radialis longus. Moving on to now the actions associated or functions associated to the extensor carpi radialis longus. As you see now here, this image of the muscle in action. This muscle is a weak flexor of the forearm at the elbow joint, and when contracted, it aids in movements within the wrist joint, such as dorsal extension when it assists fist closure, and abduction or radial deviation of the hand. So basically, this movement that is represented here by this arrow, when you move your hand to the lateral side, to the side of the radius, this is why we call it also radial deviation. We're moving on to the next one. This seen here highlighted in green is now known as the extensor carpi radialis brevis. This one is shorter and thicker than the extensor carpi radialis longus. And this one will be arising from the common extensor tendon of the superficial extensors at the lateral epicondyle of the humerus, as you can see here. One important clarification, one important point that I wanted to make here on this tutorial, that sometimes these muscles of the posterior compartment are also referred to as extensors of the forearm. So sometimes the superficial group is also known as the superficial extensors of the forearm, as the deep group is also known as the deep extensors of the forearm. Now that this clarification is made, we're going to move on now to the insertion point of the extensor carpi radialis brevis. And this muscle will be attaching to the posterior side of the base of the third metacarpal bone, as you can see here. So this is the base of the third metacarpal bone, or the bone that is in direct connection to then the middle finger. Now also a word on the different functions or actions associated to the extensor carpi radialis brevis. And like the longus, this muscle is also a weak flexor of the forearm at the elbow joint. And when contracted, it will also help with movements within your wrist joint, namely then a dorsal extension or assisting fist closure, and also abduction of the hand, also known as radial deviation, which you see here represented by this arrow. So when you move your hand to the lateral side or towards your radius, that's why we call it also radial deviation, because there is also ulnar deviation, which is when you do the opposite movement. We're now ready to move on to the next muscle that you see here highlighted in green. This one is known as the extensor digitorum. This muscle will be originating from the lateral epicondyle of the humerus, which is this area here of the bone, and you notice where the muscle is originating from. Then as you can see in terms of insertion points, you notice that the muscle will be dividing here distally into 4 tendons, or 4 smaller tendons, which insert at the posterior surface of the middle and distal phalanges of the second all the way to your little finger or the 5th finger. And notice here that these are the middle phalanges, and these will be then the distal phalanges. And notice how the muscle is attaching in these areas of your digits. We're going to move on to then the functions or actions associated to the extensor digitorum. This muscle's contraction will cause a dorsal extension at the wrist joint, as you can see represented by this arrow and the movement that you see here on this image. So this is dorsal extension at the wrist joint. And furthermore, the extensor digitorum has a role in extension of several joints, including the metacarpal phalangeal, the proximal interphalangeal, and distal interphalangeal joints of the second to fifth fingers. And if I use this image here, I can show you that the metacarpal phalangeal joints are found between the metacarpal bones and the proximal phalanges. And the proximal interphalangeal joints will be then found between the proximal phalanges and the middle phalanges of the fingers. And of course, the distal interphalangeal joints will be found between the middle phalanges and the distal phalanges of the fingers. And these will be then moved or extended by the extensor digitorum. And due to the fact that its insertion tendons are partially connected to each other through the dorsal aponeurosis, when one finger extends, it will simultaneously lead to slight extension of neighboring fingers. Next muscle that we're going to be talking about that you see now highlighted in green, this is the extensor digiti minimi. And the extensor digiti minimi is a slender muscle of the forearm and will be originating from the lateral epicondyle of the humerus, as you can see here. The muscle goes all the way to then insert on the dorsal aponeurosis of the little finger. Its muscle belly often blends with the extensor digitorum. As for the functions or related actions to the extensor digiti minimi, this muscle will be able to cause extension at the wrist joint as well, and also extension of the little finger, as you can see here. And this all has to do with the fact that this muscle will be inserting on the dorsal aponeurosis of the little finger. So when contracted, it can cause that extension of the little finger. The next muscle that we're going to be talking about, now seen here highlighted in green, is known as the extensor carpi ulnaris muscle. And the extensor carpi ulnaris is a skeletal muscle that is located on the ulnar side of your forearm. And you can see here now clearly on this image, this is part of the ulna, as you can see a bit behind the muscle. And this would be then the radius. It has its origin point at both the lateral epicondyle of the humerus, which you see here. You can also say that the muscle has two heads, and one of the heads will be originating from the lateral epicondyle of the humerus, while the other head, which is known as the ulnar head, will be then originating from the posterior surface of the ulna, as you can see here. Now the muscle goes all the way to then insert at the base of the fifth metacarpal bone, as you can see here on this image. This is the fifth metacarpal bone, and the base of the bone is found right about here, where then the muscle will insert. Now we're moving on, talking about the different functions or actions associated to the extensor carpi ulnaris, and you see two images here of the muscle. The one on the left shows the muscle contracted, while the one on the right side is showing just the muscle with no contraction. And as the name suggests, extensor carpi ulnaris, meaning that it's going to extend the wrist, this muscle is also responsible for extension at the wrist joint, which you see here represented by this arrow. And in addition, the contraction of the extensor carpi ulnaris will pull the hand medially on what we call ulnar abduction, which I mentioned before, and you see here represented by this arrow. So when you move your hand towards the medial side of your body or towards your ulna, and this is what we call then ulnar deviation.